From here, I would like to explain about social resources available to children and their families in Japan. First, let me explain about public institutions. The Child Guidance Center is a prefectural agency, established in each prefectural area. It is an institution that handles and resolves cases of abuse that have been reported or consulted on. It has a temporary shelter to protect children temporarily, and after that, it decides whether it is better to leave the children in an institution or to return them to their families. The other is the Child and Family Support Division, an agency in each municipality that serves as a point of contact for consultation on day-to-day concerns about child care, consultation from the child, and procedures for using welfare services. Next, I will discuss consultation support organizations. First, the core consultation support centers provide support to individuals and their families 24 hours a day through comprehensive consultation services related to disabilities. They are also institutions that address local welfare issues and are located in each municipality. Developmental disability support centers are prefectural institutions that provide specialized consultation on developmental disabilities and advice for supporters. The regional support centers for hikikomori provide telephone consultation services to individuals and families who have withdrawn from their homes and, depending on the content of the consultation, connect them to appropriate support organizations for medical care, health, welfare, education, employment, etc. The center functions as a consultation service specialized in the field of withdrawal. The following is a partial list of daycare facilities. For preschool children with developmental issues, there are child development support centers that provide medical care and education. For children with intellectual or developmental disabilities who are elementary school students or older, there are facilities where they can spend time after school playing together, learning together, and receiving physical therapy and training. Free schools are places where children who cannot attend school for whatever reason can spend time, play and engage in various activities, and function as a place to stay and study. Hospitals also have daycare facilities. These places where children can spend time outside of the home or school can support them in society and help them develop social skills. They can also receive specialized treatment for their disabilities. Finally, there is also support through home visits. Visiting nurses can visit the patient regularly to check on the patient's health from a medical point of view, provide mental health care, and offer consultation if the patient's doctor at the hospital directs it. Consultation from family members is also possible. The core consultation support center mentioned earlier also provides support through visits. The center visits households where people with disabilities and their families are unable to come to the center and provides consultation on daily life from a welfare standpoint and works with them to find solutions to their problems. Then I would like to introduce some of the unique aspects of the school. In particular, I will talk about special needs education in Japan. In addition to regular classes in elementary and junior high schools, classes for children with disabilities, called special needs classes, are set up in separate classrooms in the schools. Normally, schools are set up separately for children with severe disabilities, but these classes were established in the form of special needs classes so that children with disabilities can also learn within the regular school. The curriculum is designed to meet the needs of each disability. In addition to regular classes, special classes for the mentally disabled and developmentally disabled have special classes called independent activities, to help them develop the ability to live independently and to be self-reliant. In addition to teachers, school counselors and school social workers are also assigned to Japanese schools. The following is an explanation of each of these professionals. School counselors are mental health specialists who provide counseling and mental health care mainly to students. School counselors are present in 80 to 90% of all schools in Japan. Some schools have counselors every day, while others have counselors only one day a week. On the other hand, school social workers are assigned to only about half of the elementary and junior high schools in Japan. Their working conditions, like those of school counselors, also vary. It is important to improve the quality of life QOL of each student and to create schools and communities that support this quality of life. In addition to the field of education, school social workers are required to have specialized knowledge and skills in social welfare, and to provide support to children and students with problems by using a variety of support methods, such as working with the environment in which the children and students are placed and building networks with related organizations. The role of school social workers can be broadly divided into direct support and indirect support. In direct support, the school social worker visits students and their families, and personally connects students and their families with relevant organizations. On the other hand, indirect support includes building support systems for schools, providing professional advice, and mediating cooperation with related organizations. In recent years, both in Japan and at home, problems have become more complex, and the presence of such specialists is increasingly sought after. However, as mentioned earlier, the presence of school social workers varies from region to region, and they are not always available, making it difficult to provide support. Finally, I would like to talk about my work as a social worker. I would like to end with a brief account of what I have done in the child psychiatry unit. Social workers support families and children, especially those with significant psychosocial problems, by solving or improving their problems and creating a safe and secure environment for them to live in after discharge from the hospital. We provide consultation for a variety of life problems, such as abusive families, families with poor family functioning, families in financial need, and families struggling to make ends meet after discharge from the hospital, and we work together to solve problems and provide support using a variety of social work approaches to find ways to improve the situation. I would like to talk about my job role in the ward. Attending community meetings, organizing and participating in workshops and study groups, and developing new resources. The first thing I do is provide support to children as individual support. I consult with children who have various life concerns and worries, and support them by thinking together and making suggestions to solve their problems. We also support children who have difficulty in expressing their feelings, by speaking up on their behalf, and by taking the perspective of protecting their rights. For example, we will discuss with them how to spend their time at home, their career path, where they can spend their time outside of the home, who they can talk to other than their family members, and how to protect their rights. We also participate in group activities together to promote and monitor the child's growth. Next, we will discuss support for families. Families of hospitalized children may be highly anxious, lack confidence in their parenting skills, or feel isolated and hopeless. We are aware that family support is an important part of our role. We help families and their children to feel safe again by working with them on their hardships and efforts, working with them to adjust the home environment, and providing information on places in the community where they can consult with us. In such a situation, the ability to assess what kind of things are necessary for this family and to connect them to appropriate services and institutions and to collaborate with those institutions is very important. Sometimes we guide them to family meetings and recommend peer counseling. It is also important for the hospital to establish connections with the community, so that together we can provide support for the child and her family through various types of collaboration. We also need to develop new people and institutions that can support us in order to expand the circle of support for children. While doing this kind of work, the impact of COVID-19 has changed the way we live and work. It has limited what we used to be able to do and made it more difficult to provide support. Specifically, we are no longer able to visit the patient at home, or go and visit the patient on outings before discharge, making it difficult to assess the environment and build support. Visits to the ward were also banned, and communication with family members became more difficult as they could no longer see them on a daily basis. Group activity therapy has been greatly reduced, and there are fewer opportunities for children to challenge themselves and practice and grow. In addition, it has become difficult to provide support for discharge from the hospital, because it is no longer possible to visit the resources that the children would like to use after discharge. Opportunities to practice for discharge have decreased. We faced a variety of problems such as these. In spite of this situation, we thought about how we could support them in the face of the impact of COVID-19. One idea was to utilize the online web, such as Zoom, to hold meetings with outside agencies and to conduct tours of social resources. We also began to use email, which we had not used much in the past, as a means of communication with agencies outside the hospital. Sending emails when we need to communicate non-urgent business has made it easier to get information across. I also feel that being able to share information and hold meetings without having to visit or have someone come to the hospital to meet with me has conversely made my work more efficient and convenient than before. Since visits were prohibited in the hospital wards due to infection control measures, there were fewer opportunities to meet with family members, so we began to support them by calling and talking to them, reporting the situation to each other, and communicating with them. For the children, we worked together to consider ways to implement group activity therapy with as few risks as possible in order to prevent infections. Although we were able to do less, I think it is very important to think of ways to support children and their families without compromising the quality of support as much as possible. Finally, COVID-19 is subsiding and the world is returning to normal. Hospitals are still finding it difficult to do things the same way they did before, but some things are slowly returning to normal. I think that will continue to progress in the future, but looking back over the past 3 years, I don't think that the impact of COVID-19 is all that we have lost. I think that overcoming many difficult situations has conversely given us the strength to overcome adversity, and that we have also been able to find more convenient ways of doing things than before, which has improved the efficiency of our support. From now on, I hope to take a positive view of the impact that COVID-19 has had, and I hope to further improve my support for children and support their happy lives.
ご視聴ありがとうございました。ではまた次の動画でお会いしましょう。さようなら。チャンネル登録よろしくお願いいたします。